Ever wonder why lips and mouths that have been treated look so unnatural? Well, the reason is the focus is always on one thing, and that is fillers. And as you're gonna see in this video, the treatment and rejuvenation of the mouth is far more complex and multifaceted. You're gonna see things and hear things today that you probably have never thought of, but they're extremely important if you want a natural, powerful rejuvenation of the mouth. Hi everyone, I'm Dr. Karam. I'm a board certified facial plastic surgeon. I'm also the founder and creator of Karam MD Skin. And today we're gonna talk about the rejuvenation of the mouth, an often misunderstood part of the overall facial rejuvenation. And today you are going to become experts. So in today's video, we're gonna talk about 4 fundamental changes that are happening around the mouth. We're gonna talk about volume loss, we're gonna talk about elongation, we're gonna talk about skin changes, and we're also gonna talk about adjacent structures that affect the perioral region. I'm gonna list out a number of pitfalls that can happen around treatment of the mouth. And if you haven't already, make sure you tap subscribe so you can follow along. We're really trying to grow this channel so we can start inviting other guests and really make this channel something special. And most of you watch these videos but don't subscribe. So make sure you tap subscribe, ring the bell, and join the Karam MD family. Let's start talking about what happens to the mouth as we age. Number 1, elongation. Now remember, in past videos, I've talked about the entire facial structure begins to elongate as we age, right? And I'm talking really about late 40s, early 50s. There's a sudden onset switch almost that the fascial girdle of the face that holds everything up begins to let loose and everything starts to elongate. That's where we get the jowls and the neck laxity and the hooding around our eyes, etc. But guess what? The mouth is no exception. We also start to see an elongation of the upper lip. During youth, that upper lip typically measures around 13 to 15 millimeters, and sometimes even shorter. As we age, it elongates to between 18 and 21, 22 millimeters. That's a significant elongation that occurs during the aging process. When that happens, the top lip becomes longer, the smile becomes flatter. As a result, the red lip begins to invert internally. You see less of the top red lip, becomes thinner, and you don't see the bottoms of the top teeth. So it's a kind of coverage that happens, a draping over the teeth, which is termed dental show. It's something that cosmetic dentists really concentrate on and think about, especially when they're putting in veneers. They're trying to put veneers in long enough to where you can see maybe the bottom 2-3 millimeters of the top teeth, because that's a youthful, beautiful, and even sensual look. When the top lip gets longer, it covers the teeth and that dental show disappears. It's a sign of aging. Another telltale sign, and you might be wondering about this, because honestly, for years that I've been treating patients for facial rejuvenation, I didn't quite understand what was going on. Patients would come in complaining about when they smile, the top lip forms a crease, and that crease leads a horizontal line across. Now, the first thing they want to do is fill that area, and for years we tried doing that, and it ended up looking unusual or not even helping. But the reason why that horizontal crease occurs is because the top lip has gotten longer, and then there's a bending point, a break point in an unnatural position, which oftentimes the distance between the bottom of the nose and that line is typically indicative of how much that lip has gotten longer. So if you see this in yourself, now you know why. So these are all things that you can actually test on your own. However, you're gonna find out in a moment, it's more nuanced than that. So it's not just like, oh, my lip is 20 millimeters, I need to go get a lip lift. I'm gonna explain a little bit more in context when we get down to treatment. So now let's talk about volume loss around the perioral region. So this is very similar to the periorbital volume loss that I talked about in the last video, where it's not just one area, it's not just, the lips that lose volume. It's the entire surrounding area. The perioral region, the way I define it, includes basically everything under the nose down through here and here. So almost like a square around this area. That includes the upper nasolabial folds, it includes the lips, it includes the white tissue around the lips. It also includes the chin and pre-jowl region. So what is a pre-jowl? Pre-jowl is this area right before technically where the jowl begins. You begin to lose a little bit of volume. Now the volume can happen in the way of fat, as we lose some fullness in this whole region right in through here, this pre-jowl, and even the chin area loses a little bit of fullness. It extends into the actual lips, the red lips, begin to deflate. You see a shrinking effect happening there as the deep fat pads of the lip begin to diminish. And then also in the precanine fossa, which is right up in here, you lose some volume in that area at the same time. Now, that's all happening because of fat loss, but there's also bone in that area. The bone is the maxilla and the mandible. They begin to shrink a little bit with age as well, especially as we get much older, and that can contribute to kind of a deflated, almost gaunt effect around the mouth. And we've all seen what that looks like as we age. It's important to keep in mind because that is an important contributor to one of the changes that's happening. So now we have two changes happening as a result of aging. Let's look at the third. The third change is changes happening to the skin. What are those changes? Remember, we talked about skin in several different videos, and you can't get away from the fact that the collagen and elastin of the skin are diminishing with age. Remember, those two important protein molecules are peaked at around the mid-20s. They begin to diminish with age, and then they hit a strong descent right around perimenopause and menopause. When that happens around the mouth, you start to see fine lines, deep lines, crevices, nooks and crannies, all these complex things happening around the mouth. Vertical lines in the top lip, crisscross pattern in areas around the chin. You see deep lines forming around here as this area begins to form a crease in this region. So there's a lot of skin-related changes happening to the perioral region. It's important to understand the underlying mechanism is the same as the mechanism that's happening all around the face. And as we discuss treatment, you'll understand how that all fits in. So think collagen and elastin loss. Another point to keep in mind is the anatomy of the orbicularis oris muscle. Remember, the orbicularis muscle is this circular muscle that goes around the upper and lower lip. And when it contracts, when you do this effect like this, what you're doing is you're causing the skin to bunch inward, causing vertical lines. The common term for this is smoker lines. You've heard this before, like, these vertical lines, and people say, oh, I've never smoked before, etc. Well, you don't have to smoke. Drinking from a straw, making that expression, just living. If that skin is starting to lose collagen and elasticity, every time that orbicularis muscle contracts, pulls the skin inward, it's gonna form a line. Same effect that happens in the corrugator contraction, forming 11s in the area around here. Crow's feet is because the orbicularis oris muscle around the eyes contract and cause the crow's feet to form these horizontal lines in that area. So orbicularis oris contraction around the mouth is what's causing the vertical lines forming in the area. So whether you smoke or not, you're susceptible to this effect. Final point is grooves. So everyone gets really hung up over the nasolabial fold. Remember, nasolabial folds are normal. They're a human part of the face. There's some people have more shallow folds, some people have deeper folds, but every one of us has a fold that occurs there. And it gets exaggerated when we smile. Now, same thing that happens around this area, you have smile lines. Some people have smile lines that form here. The one thing I will say, and this is important to point out, that as we age, the cheeks do descend downward. So aside from smiling, normal animation, normal features of a nasolabial fold that you see, what happens in this area is the cheek begins to come down, and then this fold becomes heavier around the mouth, especially underneath the bottom lip. That's termed a marionette fold. And that marionette fold oftentimes becomes a very confused topic for injectors because they see that area deepen, they see the area forming, and it becomes a target for filling. Huge mistake. So before we break it down, let's first talk about what youth looks like. Youth looks like full lips. And this is clearly why people want to immediately go to fillers for treatment because it becomes such a highlight. Beautiful full lips are such a gorgeous part of a young looking face that naturally when they begin to disappear, it's the first thing you reach for is filler to fill the lips up. But as you just saw, there's more going on. So full looking lips is a part of youth. Short upper lip is a part of youth. Not having crowding from the nasolabial fold and cheek coming down as the cheeks descend downward, creating these marionette lines of nasolabial fold crowding is a part of youth. Having smooth, supple, full skin that doesn't bend and break with each movement of that orbicularis oris is a sign of youth. So the mouth looks smooth, the lips look full, the top lip looks short, you have a little bit of tooth show. It's a very sensual, beautiful, youthful look. That's what youth looks like. Contrast that to aging, You can see top lip longer, lips deflated, lots of checkered lines and wrinkles around the mouth, deepening of nasolabial and melolabial folds, or the marionette folds. And don't let me forget to talk about changes that happen in the chin, the orange peel effect. That's a very, very good one, and I want to make sure we talk about that. So I'll try to remember. Let's look at an assignment of the right procedures for the right changes. So let's break it down. So we talk about volume loss. We're going to talk about fat transfer, because that's what's lost. There's a tenet in plastic surgery: replace like with like. That's been around for decades, probably over maybe even 100 years at this point. But anytime you lose something, you want to replace it with a similar tissue. That's how you create the most durable, natural look. So transferring fat from one part of your body to your lip and the perioral region is better than fillers. But if you don't have access to fat transfer, use of fillers in the specific areas that you lose volume is going to be the approach. Lips, upper and lower, a little bit in the precanine fossa, down around here in the prejowl area. And again, less is more in these regions. You don't want to overfill them, you don't want to do too much, and we're going to talk about that in the pitfall section. Next is treating the lip elongation. The top lip gets longer. How do you know you're a candidate? Number one thing is, aside from all these parameters that I put around, tooth show, 13 to 15, youthful lip, etc. So everyone's going home and measuring their top lip. It's more than that. It's more nuanced to that. I actually, in office, that's the one procedure that, because we get most of our patients travel in for their surgery with me, we get effectively like an entire plan set before they arrive, except for the top lip, whether they are a candidate for a lip lift or not, that has to be done in person. And what I do is I basically lift it up just slightly like this, and I know how much to do that when I do it, and I lift it up and I see, does it look pretty? Does it look natural? Does it enhance the effect? Does it look more youthful? Or does it simply look weird? Because sometimes somebody might have a long upper lip, but have excessively long teeth, or might have had veneers put in by their dentist to overcome the long lip, and now if you shorten that area, you're gonna make the mouth look unusual or strange. So you basically have to have an exam to determine whether or not you're a good candidate for the lip lift. But if that top lip is getting longer, that's the treatment ultimately. And what is a lip lift? Basically, it's an approach that you take to just remove the excess long skin and then tighten up the deeper structures back up. So remember, fascia elongates, leads to the skin elongating. You want to remove both, just like you do in a deep plane facelift or vertical restore, etc. You want to reinforce the deep tissue and then remove the extra skin. So typically in my practice, I end up removing about 3 millimeters or so on average, sometimes 2, sometimes 4, but somewhere around 3 on average. And the incision is made underneath the nose at the base of the nose-lip interface, and we shape it like a bullhorn. That way it's following the natural nooks and crannies and grooves of the nostril as it meets the lip, and the incision hides beautifully and heals really, really well doing that. In the past, we've all known lips get longer, but in the traditional techniques, they would do a horizontal incision straight across the lip, or an incision at the level lip, and the scarring was terrible. The bullhorn incision has really made it possible to get these beautiful outcomes without compromising scarring and visual cues that you've had something done. So that's the technique that I use. But here's a caveat also. Before you all just go running off and asking some local surgeon to do a lip lift for you. This is important, and I hope this puts it in context. Your lip is getting longer in conjunction with everything else. If you just go and shorten up your top lip, assuming you're over 50 when you're watching this, it's different if you just have a long lip and you're in your 30s. But if everything is getting longer and you just do a lip lift, it can look funny as well, because everything else is sagging and longing around, so then it loses proportion. So in my practice, generally speaking, I do these in conjunction with the vertical restore, because I'm shortening everything up with the vertical restore, and therefore in proportion I shorten the top lip and everything looks balanced and natural. I've done them separately, and honestly they did not look great. To this point, I won't do them for people who are above the age of 50 who have laxity and a long lip and they just want a lip lift. I just won't do the case because it will look weird, and I don't want that as part of their outcome. So something to keep in mind. Skin quality is foundational, right? So the changes we already talked about. So how do you overcome that? Well, number one, be really, really good with sun protection. We've already talked about that in video. That's a foundational change. Second, your skin is the most manageable part of the whole anti-aging process. Everything else here that we're talking about requires needles and surgery and downtime, etc., but the skin does not. So you need to recognize that that's the first step towards anti-aging and looking youthful and beautiful, and having great skin is a big part of all that. So Things that are going to stimulate elastin and collagen and firm up the skin and thicken the skin and hydrate the skin and all those things are all what's important. I've made several videos on the topic of the specific ingredients. To put it into a nutshell, I literally put all those important things in the trifecta. And why do I harp on the trifecta so much? Because it's incredibly effective, it's super easy to use, and it takes all the thinking out of it. So watch the videos, we talk about all the different ingredients that are in there. Go check out our website to see what's actually in there. If you don't want to do the trifecta as a system, at least go find the individual components and use them. Do something with skincare, because that's the reason why your skin all over your face is starting to thin and fine lines and wrinkles are forming, etc. I even made the argument that you probably won't even need Botox if you were taking great care of your skin from the get-go, because young people with thick skin don't end up needing Botox. Same thing happens if you're older and your skin is thick, you don't need Botox. So this is what's happening to the mouth. The skin is thinning, the orbicularis oris is constantly working, forming these deep lines and creases. Skincare is an important part of that, period. And a final note on skincare, it's a consistency game. So it's not a do it once in a while, it's a daily for the rest of your life type of story. I'm just being real with you. That's what it's gonna take. Let's take it one step further. Let's say the cat's out of the bag, the lines have already formed, and you wanna treat them. So treatments for that area. In subtle cases, a little bit of Botox can take the strength away from the orbicularis oris muscle. So 2 units on each side, just take a little bit of the oomph out of the muscle, can soften just those lines that form when your mouth is creasing, when you're talking or animating. They don't necessarily relax or treat the ones that are already deep in that area. Tiny bit of filler can also be useful for the ever so slight depressions that are caused by that area. If you put too much, it's gonna look unusual. Now let's talk about the deep lines and wrinkles that form in this area, those kind of deep smoker lines. The best and foremost treatment by far is deep laser resurfacing. My laser of choice is the Erbium YAG, which we use the Contour TRL. Many of you have probably heard of that. I consider it the absolute best because it allows you to be precise with each pass of the laser, knowing exactly how deep you're going. Therefore, you don't get too deep and cause problems with healing. And assuming that the wrinkle is in the upper third of the skin, you can wipe it out completely and literally get a fresh palette. If the line goes deeper than that, you don't want to keep chasing it because then you can get into scarring, etc. Laser resurfacing is, think of it as like the facelift version of those deep lines and wrinkles, but it works beautifully in any case, it might not completely get rid of them depending on how deep each of those lines are. So now let's talk about these folds that happen here. When they happen, simple tests before you go get it filled, because God knows how many people try to fill these things and it really doesn't do anything. The simple test is grab a hold of your cheeks here and kind of lift up gently like this. If you do that and the fold, the line or the depression or whatever it is improves or disappears, you know the problem isn't volume loss, because treatment with a filler is to replace volume that's lost. But if you do this and the little fold that's forming here goes away, then you know the problem is because of excess tissue depressing onto that area and folding across that region. And that pleat or that fold needs to be lifted in order for it to be decompressed. And filling it won't do anything. If anything, it'll just make that area look thicker and more unusual. Very important, just do this and you can see that if you're getting crowding around the mouth, etc., and doing this gets better, then the treatment for that is going to be a facelift, a vertical restore, etc. So here's another couple basic points that you want to keep in mind. There are muscles that attach to the corners of the mouth of this area called the modiolus, and they come down to here as well. So some of these muscles depress the corners of the lips, some of these muscles elevate during smiling. As we age, for what exactly reason I don't know, the depressors tend to become a little bit more prominent, and as a result, the corners of the mouth droop down and you get a little bit of a frown and even a little bit of a groove. So despite the efforts, let's say you have a vertical restore, a facelift, you put fat transfer, you do all these things, and you still have a little bit of a downturn. And I see this with my patients all the time. And they, even though it's a lot better as you decompress the fold, there's still a little bit of a groove in the corner. That's not gonna get better with those surgeries and all the things that we talked about. What actually can help a little bit, it may not make it completely go away, and I don't even know exactly the underlying reason. It might be because of the bone loss that's occurring, I'm not sure. But this imbalance of muscle can be improved by putting a little bit of Botox in the depressor muscles around this. And we did a whole video on where to put Botox, etc. But you putting a little bit of Botox here helps decrease the activity of the depressor, allows the elevator to take over and lift up more. Coupled with a tiny bit of filler into the actual groove, you can make the area quite a bit better. Again, they may not completely go away. So expectation setting is very important. Consider this an expectation setting point that I'm making. So So let's talk about some common mistakes. So I listed some down here for myself. Number one is overfilling the vertical lines. Now, those lines here, there's a number of different types of fillers that have come out that are literally designed for these lines. And anything less than a tiny touch of them can lead to convexities, they're bumps along each of these areas. So you give up a depression for a bump. You have to be so skilled and so gentle at just leading a tiny little bit there and so disciplined that that doesn't occur. But overfilling those lines around this area, unfortunately, very common and oftentimes becomes kind of a permanent disaster in that region. So be very mindful before you reach for filler for those lines that that's really not the best treatment. The best treatment is actually to almost like sand it down with a laser. Think about it that way. You want to remove the line as opposed to trying to fill the line. Because as long as that orbicularis muscle is working, you're going to keep wanting to push that line into it, and now you've got filler kind of being shoved around and displaced in a very unnatural looking way. And as you know, as I mentioned before, fillers are not temporary. They are going to be permanent to some extent. They're going to be replaced by collagen. They're going to have changes that are going to make it very, very difficult to remove that area. And as a result, you're going to find yourself very unhappy with all these different irregularities in the top lip. All right, next one. This is a very, very good one. Remember what we said, everyone wants to go and fill their lips when they deflate. And if you have elongation of the top lip and you fill it because you can barely see your top lip anymore, let's just say, or a lot less than you used to, and you go to fill it, that's a perfect setup for the duck lip because you don't have that much lip to fill, and the injectors fill mostly on the outside part of the remaining red lip, and it causes the red lip to jut forward. Now remember, in a natural youthful position, the bottom lip is actually fuller than the top lip, and the bottom lip actually extends slightly beyond the top lip if you were to look at it on profile. So when you do this and you cause the top lip to go forward, you get the duck lip. And the way to avoid that is, number one, not put filler in an elongated top lip, or use such gentle amounts of it that you barely are going to make a difference, which kind of defies the point of why you should even do it in the first place. Realistically, a lip that is deflated and has gotten long should be treated with a lip lift and volume augmentation. That's how we generally approach it and treat it, and never get a duck lip even if we refill the lip to its maximum youthful level. Next one is doing a lip lift if you've already got sagging all over. And what I found is it almost triangulates the mouth a little bit because everything gets pulled up here, but everything else around here is long. As you can imagine, it creates this triangle effect, which is very unsightly and unattractive. So doing a lip lift in a face that is elongated and sagging is not going to help your mouth look younger. It's just going to make it look a little unusual or different. So I'm not a fan of doing that combination, especially if you do a more aggressive lip lift, which oftentimes can happen. Surgeons don't use it in a conservative way and oftentimes take too much, and then that really kind of creates that triangulation of that mouth, which can be unfortunately permanent. I mean, you can't put the tissue back. So as I mentioned earlier, using Botox for these fine lines around these areas can be very useful. I mean, for those vertical lines in the early stages, definitely. However, if you use too much of it, that lip becomes essentially frozen. It's not going to become animated. And as a result, you'll see that top lip will basically be flat during smiling or just kind of like flaccid. And that's obviously not a good thing either. It's not an attractive look. And I'm using Botox, all the units for all the different neuromodulators are different. But for Botox, 2 units on each side typically is the right amount. You can maybe do 3, but you should really be more conservative. You're just trying to take the edge off the muscle, not completely knock it out. And if you do it gently, you can even get a little bit of a lip lift with it. So I think they call it a lip flip with a little bit of Botox, but just subtle amounts, conservative. Again, if you can start to hear this theme coming through, being conservative is better than being too aggressive. Another pitfall is you put a lot of pressure on your laser surgeon. Your expectations are very high. You want all those lines to completely disappear. And guess what? They end up going too deep with the laser. I always set up the expectations for limitations. If lines are deep again, you don't want to chase them all the way down. With a erbium YAG, you can see exactly how deep you're going, and you get to a place where you're like, okay, this tissue is now at a place where if I go any deeper, it's not going to heal, or I'm going to heal with a hypertrophic scar, etc. And I've done that. I've had that mistake before, so I'm speaking from experience. That's not a good thing because the result is obviously going to be way worse than having lines and wrinkles there. Have a bunch of scar on your lip. So go for improvement, not full correction if it's outside of the window of possibility. But experience with this is really, really important. Oh, I just remembered that final thing that I was talking about earlier, the orange peel around this area. So a lot of times people see this kind of orange peel effect around their chin, and they think it's a bunch of little depressions, so they go to fill it. I can't tell you how often injectors misdiagnose this. The reason why this orange peel is happening is because of the mentalis muscles contracting. For whatever reason, it starts to contract a little bit more aggressively as we age in some cases. The treatment is a couple units of Botox to relax the muscle, not filling it. If you fill it, again, you get this kind of irregular, weird looking, chin. And if you just relax that muscle, everything smooths out and looks beautiful and natural, and you'll see the results. So orange peel, think Botox. Keep that in mind. So now I'm gonna show you a series of before and afters, and we'll list out the procedures that were done in conjunction in overall rejuvenation of this area. The most common combination is going to be vertical restorative, lift up the soft tissues around this area, lip lift, and fat transfer. You'll see some examples that'll just be lip lift without the vertical restore and may or may not have had some fat transfer, but usually if not fat transfer, it's gonna be a little bit of filler. And you'll see some examples that'll be literally everything, lip lift, lasers, vertical restore, fat transfer, the combo. Keep in mind that each of these cases go through the same rigorous point-by-point check to see which ones would be beneficial for the person before we go in and do them, so that we have a good plan. At the end of the day, they all look natural and normal, etc. And as you'll see, this is a winning combination. It's a very beautiful combination. We don't need to do laser resurfacing as often as we need to do the lip lift and the volume augmentation, but in some cases it's necessary, and when we do them, they look beautiful. All right, so let's take a look at these. All right, so let's recap. The name of the game is a natural, rejuvenated, beautiful, sensual looking mouth. We want to get it close as possible to when you were younger. This requires a multifaceted, balanced approach addressing any component that is a part of it. It's more complex than probably you thought. It's not just go to your local injector, dermatologist, plastic surgeon, and get a bunch of filler in and call it a day. One size does not fit all. Fillers is not the answer for every aspect of these things, and ultimately certain choices have pitfalls. Err on the side of conservatism. Try to keep all of these things in mind. As somebody is counseling you and giving you their opinion, now you are armed with 20 years of my experience dealing with nothing but rejuvenation of the face and mouth and all these other components. So you have a counterpoint to advocate for yourself. In general, don't go for home runs, go for singles and doubles. A little bit of improvement is better than overdoing something and finding yourself disappointed and embarrassed, right? So I think that's really another really important part of all this as well. All right, my friends, so that does it, mouth rejuvenation. I hope you found this beneficial. If you found it helpful, make sure you subscribe to the channel. Make sure you hit like. Any questions you have, comments, please drop them below. If you've had some experiences with rejuvenation of your mouth and your lips, etc., whether they were good or bad, drop them in the comments. Share them so the community can benefit from them, and I can read them and hear your stories as well. I always find that to be an important part of this channel. And for those of you who want to learn more about the trifecta, make sure you check out the website, karammdskin.com, and follow along with my free newsletter, the Karam MD Journal, that's delivered to your email, and it's a fantastic resource of all things rejuvenation. For more information or to schedule a consultation for rejuvenation, check out drkaram.com. All right, guys, until next time, my pleasure, as always, helping you be empowered. Thanks so much, Dr. Mir Karam.